Hello and welcome to another episode of Keeping London Healthy. I'm Dr. Mario Elia. On today's episode, we're going to be talking about alcohol. It's a topic that I see day to day in my office. It's a topic that obviously permeates our society, always in the news for good or bad. And it's a topic I don't think we've ever actually discussed on the show in any great detail. So I thought it'd be a good idea to tackle it today. We're going to be tackling a few different pieces of this. We're going to be talking about current recommendations when it comes to alcohol consumption and maybe how that's evolved over time. We're going to be talking about potential negative consequences of alcohol, which a number of which I know people really don't think of. So we're going to be talking about kind of the medical consequences of alcohol. We're going to be talking about what a substance use disorder is. So when does alcohol become concerning? And lastly, we're going to talk about how to get help for those who either self-identify or, if you know somebody who has an alcohol consumption issue, how to get them help and what's available for help. So we're going to be taking you through this conversation today. Before we get too deep into the topic of alcohol, I wanted to talk really quickly about an unrelated issue that I saw in the news this past week. Sadly, there was an announcement today from Hamilton that a child in Hamilton has died of the measles. Unfortunately, an unvaccinated child died of measles. And the reason I want to bring it up is I'm seeing more and more issues here in my practice with parents deciding not to vaccinate their children, which is a bit, I'll say, surprising in that over the years with the relationships that we've had with our patients, families deciding not to vaccinate their kids have been few and far between, thankfully. And unfortunately, I've noticed, and most of my colleagues have noticed that over the last 5 years, we've been having more parents who have been refusing vaccines on behalf of their children. And we educate and try to encourage and explain pros and cons of vaccination and share our own stories that, my children are fully vaccinated. There's a reason we do this, that these are illnesses that should be in our rearview mirror. These are preventable illnesses that these vaccines prevent. With more and more parents refusing vaccination, unfortunately, this is something that we're going to see more and more of. And again, tragedy in Hamilton with a child actually dying of the measles. They've had a number of cases in Hamilton in children, all unvaccinated, not surprisingly. I trust that no parent is actively making decision that they think could harm their child, right? And they don't want to do anything that they think is going to harm them, and that's why they're refusing the vaccination. But I think it's really important that they realize that it can have tragic outcomes. All right, so we'll switch gears. So again, topic of today's episode is alcohol, and we'll start with kind of why I thought it'd be an appropriate topic to address. I can tell you in my own practice, and I share this kind of anecdote with patients, that as much as we talk about smoking and we know the harms of smoking, and we have policies in place in society, whether it's limiting smoking indoors and taxation on smoking, we've generally, I know, acknowledged society-wide the harms of smoking, and it's rightly kind of the act of smoking is rightly vilified. Not the people who smoke, but the act of smoking. We know the harms, and we share that widely. Whereas alcohol seems to be kind of in this gray area in people's minds, where we know that far more people consume alcohol in society than smoke. It's ingrained in our society. Gatherings are often associated with alcohol. We go to sporting events and people drink. Commercials on TV, sponsorships. Over time, it kind of gets normalized, and then we have situations like we're seeing. Again, we're not going to get into the politics of it, but we see convenience stores being able to sell alcohol in the province of Ontario, which we know is going to increase consumption. So part of my motivation today was to kind of tackle this issue and give everyone a baseline level of knowledge when it comes to alcohol and what's available in terms of, again, getting help, who needs help. And so let's start with the recommendations first. And what are the recommendation when it comes to alcohol? What is a safe level of alcohol? And anyone who's followed this story over the past number of years know that this has changed, which I know kind of confuses people when we tell them that alcohol is safe and then not so much, and how much to drink. So I'll take you through a bit of the story. When I trained, the recommendation was that the recommended amount of alcohol for a male not exceed 14 drinks per week, and not exceed 4 in any one given day. And then the recommendation for females was no more than 9 per week and no more than 3 in any given day. So that was a recommendation. Gender difference was kind of debatable why there was a gender difference, but that was the recommendation at that time. There's also been kind of some evidence over the years that the optimal amount of alcohol was 1 to 2 drinks per day. And this came from studies done. They would do a curve. They would analyze an entire population. So along the bottom, think of how many drinks per day, and on the side it would be risk. And it looked like there was a J-shaped curve, meaning that the bottom, so the lowest risk, was for those who were consuming kind of 1 to 2 per day. Those who were consuming 0 per day were actually a bit higher risk. And then again, as they went to 1 or 2, the risk went down. And then as they had more than that, the risk went up. So this J-shaped curve has been talked about for decades now, in that alcohol might be protective. Well, we've kind of evolved from that over the last few years, understanding that there probably is no true safe amount of alcohol consumption. And the reason why we were seeing that dip at 1 to 2 drinks and then coming back up was that the people who were drinking no alcohol included 2 very different groups. Part of that group drinking no alcohol truly had never had an alcohol issue, just decided to drink no alcohol. That was how they were kind of self grouping. But that group that had no alcohol also included those who were told by their physician specifically to have no alcohol because of a health concern, potentially that they were abusing alcohol in the past, and now they are not drinking. So we know they were going to be higher risk. And it includes people who are on medication or with heart issues, or or undergoing cancer treatment, or a whole host of other issues that they've been told specifically not to have alcohol. So again, those in that J-shaped curve, those who were not drinking any alcohol at all, looked like they had a higher risk than those who had 1 to 2 drinks, but it was because of their underlying conditions that they were self-selecting into the 0 alcohol group, not that alcohol was actually protective, and that's why the risk was lowering as someone would drink more alcohol. So if that makes sense. So we've kind of moved away from the idea that alcohol is helpful in any amount. Years ago, there was some talk of a component in red wine that might have antioxidant effects, and was this going to be beneficial? Again, we moved away from that, knowing that there is no true safe amount of alcohol. So the guidelines from an organization called the Canadian Centre on Substance Use and Addiction. Some of you may have heard this in the news, I think it was just over a year ago, where they tried to clarify, what people should know about alcohol consumption. What is a safe amount? So they've broken down what they've called a continuum of risk. So we start at 0 drinks per week, where they state that not drinking has benefits, such as better health, better sleep. 2 standard drinks or less per week means that you're likely to avoid any alcohol-related consequences. So that's 2 drinks or less per week. When you get to 3 to 6 per week, that starts to increase your risk of a few different cancers. So breast cancer, colon cancer. And again, that's only at 3 to 6 drinks per week. Now, how much is it increasing your risk? Okay, it's not doubling your risk or anything, at a huge magnitude, but there is some increase in risk at even 3 to 6 standard drinks per week. We'll go up to 7 or more per week, and that increases your risk of heart attack and stroke. And so that's at 7 per week. And then each additional drink above that, radically increases risk of, heart attack, stroke. Again, we're going to talk about all the negative consequences in a second, but at above 7, then things really start to go up per week. Okay. And then they clarify that obviously around pregnancy, there's no safe amount of alcohol consumption, and that even when breastfeeding, that not drinking alcohol is safest. So again, we've gotten away from that, 14 per week in men, 9 a week for women, and using that as our target, to really what is true, that anything above 3 drinks per week and above does increase your risk. Again, everyone needs to individualize that risk for them, right? Because some people may be willing to take some additional risk because they enjoy alcohol and it's important to them in certain settings. But we have to be honest about what the actual risks are. And we're going to take a quick break and we'll be right back. All right, welcome back. Again, today we're talking all about alcohol. I'm going to switch gears to talk about the potential negative effects of alcohol. And again, this isn't meant to drone on and on about how bad alcohol is, but it is important for us to understand how diverse its effect is on so many different body systems. One thing that people are surprised to hear, again, I talked about smoking earlier on, and I tell people very openly that in my own practice, again, been in practice 12 years now, I've had more patients die of alcohol-related consequences than smoking-related consequences, and it's not particularly close, actually. And again, I don't think people would guess that, given what how we view smoking and how we view alcohol. But in my practice, it's been definitely I've had more patients end up dying of alcohol-related consequences than smoking. So we'll take things body system by body system. What are the negative effects of alcohol on someone's body? So we'll start with your brain. We know that alcohol is a depressant, so definitely increases the risk of depression. Definitely affects quality of sleep, can affect mood, behavior, coordination. We know that it increases the risk of stroke, increases the risk of dementia. I've had patients who have drank more than recommended amounts over the course of their life, and almost certainly have developed dementia in my practice. And I can put at least a bit of that blame on their alcohol use over time. We'll move on to the heart. So what does alcohol do to the heart? We know it can increase the risk of heart failure, something called cardiomyopathy you can get over time, increase the risk of coronary disease, so risk of having a heart attack, increase the risk of atrial fibrillation. So atrial fibrillation is a condition where your heart beats irregularly, and which can cause patients to feel palpitations or fatigue or lightheadedness, but also increases the risk of stroke. And alcohol definitely increases risk of atrial fibrillation in the heart. Also puts blood pressure up. One of the first things that we do when someone comes in with a high blood pressure, and we're taking a history to figure out, are there some reversible causes that we can address before we turn to a medication? Alcohol ends up being a common cause of someone's elevated blood pressure, and we know that reducing alcohol consumption can definitely help someone's blood pressure. Moving on to the mouth, so we know it increases risk of oral cancer, down to the esophagus, increases the risk of esophageal cancer, into the stomach, gastritis, so an inflammation in the stomach or ulcers. Liver, so obviously when people think about alcohol, they think about the liver, so we'll touch on that. So it increases the risk of both fatty liver to start with, and then over time, those who consume higher levels of alcohol can develop cirrhosis. So that's thickening of the liver, which causes it not to function well. And those with advanced cirrhosis, so advanced thickening of the liver, that's when patients get these distended bellies. They can get veins in their esophagus that can bleed. They can get confused from it. Sadly, over the years, I've had probably around 10 patients die of cirrhosis related to their alcohol use. And it'll also increase the risk of liver cancer. Moving further down, it can increase risk of colorectal cancer, so colon cancer. Can cause pancreatitis, which is an inflammation of your pancreas, which often requires hospitalization. This is when patients get severe pain in their upper abdomen. They get nauseous. They often vomit. Just had a patient hospitalized within the last few weeks with pancreatitis. Not a nice condition. And if they get repeated pancreatitis, then the pancreas doesn't work as well, and you can get diabetes as your pancreas doesn't work well. Can cause osteoporosis, so the quality of someone's bones who consumes higher than recommended levels of alcohol can increase the risk of osteoporosis as well. So the cancers are the big one that I think people don't think about when it comes to alcohol. They think about the liver, and that's kind of the main one. But we know that alcohol does increase risk of breast cancer, liver cancer, colon cancer, and cancers of the mouth. So again, I know it's a laundry list of things, and it's not specifically meant to kind of scare anyone, but it's important to understand how many different systems it affects. And again, that doesn't include kind of the immediate intoxication effects of drinking, right? Whether that's trauma, trauma to yourself, trauma to somebody else. Behaviors that change around alcohol that may affect our relationships, risk of drunk driving, risk of drowning. So other things that we know can increase risk with alcohol. Now, when does alcohol become problematic, and how do we label this? We talked before about the recommendations in terms of less than 2, 3 to 5. We talked about that. What about medically when we actually diagnose someone with a problem with their alcohol? How do we do that? So the first thing is we don't use kind of what we see as slightly derogatory terms. So the terms like alcoholic or drunk or things like that that have been used in previous generations, we don't use anymore. Not to be kind of politically correct or PC, or because we're afraid to use these terms, but really we have more accurate and kind of compassionate ways of describing this, which allows us to then help the person and be able to describe it in a way that they don't feel ashamed. So let's talk about an alcohol use disorder. So in the past, it used to be referred to as either alcohol abuse or alcohol dependence. And that's we've now lumped that together into a term called alcohol use disorder. It's in the kind of the manual for psychiatry that we use. And there's some specific criteria that we're going to outline here. And if someone answers yes to 2 or more of the questions that I'm going to outline here, we would describe them as having an alcohol use disorder. And then depending on how many yeses they get, then they're either mild, moderate, or severe. Okay, so we're going to go through some of these questions right now because I think it's helpful, both again for you watching, or maybe you know somebody who you're going through these questions and thinking, I think this might actually apply to family, friends, and it may spark a conversation with them. All right, so again, 2 or more yeses would qualify for this. So have there been times where you ended up drinking more or longer than you intended? Was there more than once where you wanted to cut down or stop drinking or tried but couldn't? Spent a lot of time drinking or been sick or getting over the after effects? Wanted to drink so badly you couldn't think of anything else? Found that drinking or being sick from drinking often interfered with taking care of your home or family or caused job troubles or social problems? Continued to drink even though it was causing trouble with your family or friends? Given up or cut back on activities that were important or interesting to you or gave you pleasure in order to drink? More than once, I've gotten in situations while or after drinking that increase your chances of getting hurt, like driving, swimming, using machinery, walking in a dangerous area, or having unsafe sex. Continue to drink even when it was making you feel depressed or anxious, or adding to another health problem, or having had a memory blackout. Had to drink much more than you once did to get the effect you want, or found that your usual number of drinks had much less effect than before. And lastly, found that when the effects of alcohol were wearing off, you had withdrawal symptoms like trouble sleeping, shakiness, restlessness, nausea, sweating, racing heart, or a seizure, or sense that things weren't there. So you can tell from those questions, it's a fairly wide variety of severity, right? Like some of these, someone would answer yes, who may not perceive themselves as having an issue with alcohol, all the way up to the most severe symptoms where they're actually having withdrawal. And the reason I think this is important is that you don't have to have withdrawal symptoms from alcohol, or have cirrhosis, or have some serious consequence from it to actually have an alcohol use disorder, which may benefit from being treated. So that's one thing I want people to take away from this. So once we've identified someone as having an alcohol use disorder, and again, in my practice, we have lots of patients who would fall under this banner. Who needs help? So the first thing I would say is the very first thing they should be doing is seeing their doctor, right? We can help with this. This is one of the things that we're trained in being able to help patients when they have an alcohol use disorder. Again, they may or may not be motivated to make a change, and that's part of our skills as well. Finding out how important is it to them to make a change. How motivated are they to make a change, and how confident are they to make that change? That's part of the evaluation that we do when we see somebody. And then we talk about what are our options and what are they interested in. So are they open to cutting back cold turkey, or cutting back slowly, weaning down on it. Identifying any health issues that they have that may make it a bit more urgent to have them cut back on the alcohol, or other issues that may complicate having them go through withdrawal, say, if they're having withdrawal symptoms. Again, different patients will need different levels of support. If I have a patient who, when they've tried to stop drinking, they've had withdrawal seizures, they're going to need a different level of intensive support than someone who's drinking, let's say 4 beers per day consistently, who I want them to cut back. They've agreed to cut back. That person who's having the withdrawal seizures, I would feel much less comfortable with them dealing with this at home alone versus that person who's drinking 4 a day, who we're going to work on getting down. So again, we have to individualize this. Some patients, again, who are having withdrawals, they may need a supervised treatment, a detox. But the majority of patients in my practice who have an alcohol use disorder, we can treat this safely at home. If it's mainly mild withdrawal symptoms, then they need some medication support for those withdrawal symptoms. Sometimes we'll give them a medication called a benzodiazepine, which will help with mild withdrawal symptoms, and we kind of gradually wean them off that over even like the first week or so. Those who don't get withdrawal symptoms, but just are drinking more than we would like, either because of cravings or because of situational factors or boredom or anxiety, we have specific medications that actually do help those patients. And I find that people don't know about these medications that actually can help. So there's a medication called naltrexone that's available. It decreases the cravings associated with alcohol. And another one is topiramate. So it's another medication. So topiramate is an old anti-epilepsy medication that we know now that when used at bedtime helps with people to not crave alcohol as much, helps with mood stabilizing, helps with if they're feeling anxious or having difficulty sleeping, it can help with that as well. And I find in my practice it's actually pretty effective. So topiramate and naltrexone are probably the main ones that we do in terms of regular prescribing when someone's trying to cut back on their alcohol. Pregabalin is another medication that's an option. That's Lyrica is the other name that you'll hear used. Again, another old epilepsy medication that we know is helpful for patients, especially when they have anxiety and alcohol, and it works for chronic pain too. So a few different things that we can treat at the same time. So again, the physician will be the best person to decide what medication works best for somebody. And not everyone needs medication too, right? Some people just through weaning on their own, changing their setting, getting counseling. The biggest thing that I think people overlook with this is the importance of seeing a counselor, seeing an addictions counselor. We have resources for this, certainly locally at Thames Valley Addiction Services, for people who are looking for help in cutting back on their substance of choice. Counseling is absolutely helpful, and treating underlying mental health conditions, right? So one of the things, whether it's smoking or alcohol or any other substance that we talk about, is why are you using the substance? What benefit is it giving to you? And not asking that in a kind of a snarky way. It's literally, what benefit is it getting because some people will drink alcohol because they feel anxious. Some will do it, again, like I said, because they'll feel bored. Some do it when they're feeling a certain way emotionally. Some do it just out of habit, because sitting down to watch the hockey game and they'll drink a number of beers. So figuring out for each individual person kind of what is underlying. And if it's a depression, we have to treat that depression. We can't just tell them to stop drinking alcohol if we're not treating their underlying condition. Is it generalized anxiety disorder and they've been self-medicating with alcohol for years? Treating that underlying condition is absolutely critical, and addressing any comorbid conditions. So if there's any other addictions issues, dealing with those as well. A couple other questions I get frequently around alcohol is, what about non-alcoholic beer? Is that safe? And really, as long as it's 0 calorie, absolutely, they can drink that their heart's content. And even low calorie is probably good enough too, much better than consuming alcohol. For women going through menopause, something that's not often talked about is the fact that cutting back or cutting out alcohol, especially wine, will significantly help the hot flashes associated with menopause. So again, before jumping to medication like hormone replacement therapy or other medications we use for menopause, one of the first things I tell women to do is make sure we're optimizing exercise, making sure we're cutting back on alcohol, and then seeing what happens with hot flashes. So hopefully you guys took something out of today, whether again it's the definitions, kind of the harms associated with it, the options for those who are open to cutting back, because I think more than anything we deal with, most of us have someone in our life who, going through those alcohol use disorder questions could probably meet the criteria for that. And the challenge for us is, how do we speak to them in a non-judgmental way, Not just saying like, I want you to cut back, but how do we start the conversation? Finding out where they're at. Are they open? Do they identify themselves as maybe having an issue? Um, do they acknowledge that there might be some benefit in cutting back? And again, encouraging them to seek care with their family physician. We're going to take a quick break and be right back after this message. Welcome back. Again, thanks for joining us today. And again, if yourself or someone you know has an issue with alcohol consumption, encouraging them to see their doctor, or if you're not sure how to start that conversation, go to see your own doctor, and I'm sure they'll be able to give you some helpful tips on how to broach that subject. And until next time, stay healthy.